All right, good afternoon, everyone. Can everyone hear me okay? Get maybe a thumbs up from the crowd. I would appreciate that. All right, excellent. Thank you so much for being here for this briefing on the state of the measles outbreak in South Carolina for November the 12th, 2025. We appreciate you being here. Sincerely, we couldn't cover the story without your assistance, so thank you for your help in doing so. With me today to talk about the latest developments is Dr. Linda Bell. She's the state epidemiologist and the health programs branch director at the Department of Public Health. Once Dr. Bell concludes her opening remarks, we'll take your questions. So without further ado, I'm going to turn it over to Dr. Bell.
Yes, thank you, Ron, and good afternoon, everybody. Today, the South Carolina Department of Public Health is announcing 8 new cases of measles in the state since last Friday. 6 of the 8 cases are household members of known cases who are in quarantine, and the other 2 cases are in the same household, but the source of their infection has yet to be determined. To date, the total number of cases in South Carolina now related to the upstate outbreak is 43, and the total number reported to DPH this year is 46. We currently have 13 people in quarantine with 1 in isolation during their infectious period, and it is possible that additional cases may occur among those in quarantine, but early quarantining of those identified as exposed has been a successful public health outcome in avoiding additional spread in the community. However, we continue to be concerned that ongoing community transmission of measles is occurring, and others in our communities are at risk because of declining vaccination coverage. And achieving higher coverage is important because measles is spread remarkably easily. And this is why we're continuing to deploy DPH's mobile health units in Spartanburg County to provide MMR vaccines to those who are not immune. Those locations were in our release that went out today and will continue to be posted online on our measles outbreak page and on our social media platforms. And we will post locations for the upcoming week as part of our regular Friday updates. Since October 16th, when the first mobile health units were deployed, DPH staff have administered 31 doses of the MMR vaccine to the public, 25 of those doses to adults and 6 to children. So we continue to encourage those who are not immune to take advantage of this no-cost opportunity to get protected against measles, its possible complications, and to prevent continuing spread in our communities. And with that, I'll stop and hand it back to Ron to help answer any questions that you might have. Thank you.
Thank you so much, Dr. Bell. And as is our usual procedure, if you'll go ahead, if you have a question for Dr. Bell, raise your virtual hand and I'll call on you in the order in which you raise it. I would also add that if you have any follow-ups, please wait for others to ask their questions first, and then I'll come back around to you happily. Tom, you have your hand raised first, so please go ahead, sir.
Hey, Dr. Bell. In the latest cases, I think really the last couple of weeks, you haven't listed the vaccination status of the new cases. So do we know at this point what the vaccination status is of the most recent cases this week and last week as well?
Of the cases announced today, I don't have that information, but to my knowledge, all prior cases, except for 2, had not been vaccinated, and 2 of those cases had received only 1 dose of the MMR vaccine. But we can follow up with you, and we'll include this in subsequent reports about the vaccination status of our most recently identified cases.
Thank you.
Lauren, go ahead with your question.
Hi, Dr. Bell, Lauren Miller with WSPA. I just wanted to ask, last time we were on this similar call about 3 weeks ago, you had said that there were only 7 people that had the MMR vaccine administered to them. Now we're talking about 31 doses. What is our reaction to this?
Well, it's progress. That progress is slow. This is since October the 16th. We had hoped to see a more robust uptake than that in our mobile health units, but we are a bit encouraged by, we recognize that this is not the only place that vaccines are being administered. So we have seen a bit of an uptake through other vaccine providers, including in our DPH clinics, as well as private providers. So we are seeing an increase. The hope is that it can be much quicker than what we're seeing right now, but we are encouraged.
Thank you for that question. Who else has a question for Dr. Bell this morning? Tom, go ahead, sir.
Thanks. So you reported yesterday an exposure, potential exposure, of measles case that went to a restaurant in Spartanburg. Is that among the cases that you are reporting today? I mean, somebody who didn't know they were infected at that point.
Well, at the time they visited the restaurant, they did not know they were infectious.
But is that among the 8 that you're reporting today?
Oh, I see. I'm sorry. I'm not certain of the 8 that we're reporting today. I apologize, but we'll have to follow up with you on that as well.
Okay, thank you.
Mm-hmm.
Baker, go ahead with your question.
Mine might be a little bit of a follow-up on that. So the 8 today, I believe at the outset you said they were all people in the quarantine group.
The 8 that were announced today, 6 of those are among contacts to known cases. 2 of the 8, we do not at this time know the potential source of those cases.
So are they? I'm not exactly sure how to think about that. So they were not in a quarantine group. That they've come out of not come out of nowhere, but they were not part of any group already identified. Can we say whether you've worked with school officials to have them quarantined, and if so, what schools?
So we do not have any subsequent exposures that have occurred in school settings. We do have of the 8 new cases, 6 of those are among the same household. 2 of those we do not have an identified source.
Okay,
none of the cases are the result of exposures in a school setting.
Okay, but 6 within one single household.
That's correct.
Oh, feel sorry for those folks.
Thank you, Baker.
Thanks.
Susan, go ahead with your question. Susan? You may be on mute. Hearing nothing from Susan. Baker, do you have a follow-up?
Sure. Well, thank you. So the no new cases that came from within a school, but nonetheless, are there additional students being asked to be excluded from school based on their condition, their situation, and are they the same from one or both of the same schools that we've already known there were cases in?
Because no new exposures have occurred in a school setting, we do not have to exclude students from a school setting as a result of an exposure that occurred in the school. Now, if any of there may be students in households where transmission has occurred, and so students may be excluded from school because of exposure in a household setting, for example, but I just want to make it clear that exposures have not happened in the school, but we may have siblings or what have you in some of these households who cannot attend school because they may have been exposed in another setting. And I do want to follow up on the earlier question about the source of the 8 cases, the 2 cases where we don't know the potential source. Actually, 2 of those cases were associated with the restaurant that we made public notification of. So I just wanted to clear that up. I don't think the question came from you, but it was from another outlet.
Okay.
Thank you for that. Lauren, go ahead with your question.
Hi, I wanted to ask the case that was identified at the Kanpai of Tokyo restaurant in Spartanburg between 3 and 6, are we able to confirm if that was an employee or if that was a customer?
Well, we're not commenting on the status of individual cases. We were just making public notification to those who may be at risk so that they can be aware to look for symptoms. And that's the most important piece of information, is a potential source of exposure in that setting. And we want people to be aware, if they're not immune, to watch for potential symptoms and to consider being vaccinated.
Okay, thank you.
Thank you for that. We had a question in the chat from Carrie Beal with Fox Carolina News. She asks, is it worrisome that we don't know the source of the 2 recent measles cases? Does that mean there could be more cases?
It is worrisome. As we've reported repeatedly, we have been somewhat encouraged by the fact that many of our cases that have occurred recently are among those already in quarantine, meaning that we are preventing additional spread from those cases because we're aware of the exposure. When we identify additional cases in the community that we are unable to link to others, that does tell us that there is unrecognized ongoing community transmission, and that is a great concern.
All right, thank you for that question. Let's see. Lauren, do you have a follow-up?
Yes. Oh, yeah, I'm so sorry. I'm asking so many questions. I just wanted to ask, with the holidays coming up, is there any concern of this number continuing to grow even more, with people flying home, people even going to, grandma and grandpa's house, just, a possibility of this number going up and that concern?
It is absolutely. This is we're coming up on some of our highest travel days. We're coming up on the times when large family groups gather together, and as we've reported, that exposure during travel on commercial carriers, visiting airports, but also traveling within the state, is a concern if we have unrecognized transmission. So you don't even have to travel. If you're accepting visitors from other places, they may have been exposed, and they could subsequently expose those just in a household who haven't been anywhere. So this is an ongoing concern, and these are serious scenarios that we're considering, that we may not know of ongoing transmission until a couple of weeks after the holiday season, especially for Thanksgiving. If we think about the quarantine period, or the maximum quarantine period of 21 days, if we have exposures during the Thanksgiving holidays, we could be looking at additional cases occurring at a higher number moving into the Christmas holidays, and this type of spread taking us well into the new year. And so this is why we continue to emphasize the importance of getting our vaccination coverage up more quickly at a higher level to get better protection in the population as a whole, because we cannot anticipate where these exposures may occur. And we're strongly encouraging people to consider that risk and to consider getting protected before an unrecognized exposure occurs.
Thank you for that question. Tom, go ahead, sir.
Thanks. So I think previously we had said that the latest quarantine was supposed to expire on November 24th, which is Thanksgiving week. Do the new cases extend that beyond November 24th now?
Yes, I believe they do, because those that are most recently exposed, and if, again, we think about potential restaurant exposures, the reason we made public notification is because we may not have the ability to identify the close contacts. Those exposed in the restaurant, those incubation periods could go 21 days beyond the date that they visited the restaurant if they're not immune. And so it does extend those days 21 days beyond the most recent exposure of any of these cases.
Well, I think that would be November 23rd, though, if the restaurants was the source. So do you anticipate this going later than November 24th? That we'll have people in quarantine?
If that is
And
our,
just send an email.
If you could make sure that your microphone is muted when you join the group, we'd appreciate that.
thanks. And I apologize that I don't have the in quarantine dates for all the cases in front of me, but if that is the last exposure date that we have announced of the 23rd, then that's what we're looking at this time.
Okay, thank you.
Sure.
Any other questions for Dr. Bell? Baker, go ahead, sir. Baker, you may be on mute there.
Sorry.
That's all right.
Thanks for your patience with me here. Did you two quick things? Did you say that among the two new cases, they may have been related to exposure at the restaurant?
No, the two new cases have an unknown source of their infections, but they are the reason that we made public notification because they were in the restaurant during their infectious period. So we are notifying others of a potential exposure in that setting. We are not saying that the restaurant is the source of exposure for those two cases.
Oh, but the two people who were infected both were in the restaurant.
Yes.
Okay, I got you. And secondly, and this is kind of a speculative thing, but do we know how well people who were vaccinated a long, long time ago for measles are protected when we think about older folks who may be in a restaurant and exposed? We've never, I don't remember there ever being a measles outbreak. I mean, do we really know how well someone in their 70s or 80s who was vaccinated a very long time ago is still protected?
Well, so people born before 1957 are expected to be immune based on natural immunity because the disease was so widespread there. And what we do know about the effectiveness of the vaccine where we haven't been seeing these outbreaks is because the vaccine does offer lifelong immunity to the majority of people, over 97% of the people who have received 2 doses of vaccine. Now, when the vaccine first began being widely used, there was a period of time where the vaccine may not have been as effective in the early 1960s, up until about, and forgive me, I'm forgetting these dates too, but I would say up until about 1967. So people who were vaccinated when the vaccine was available prior to 1967 may need to be revaccinated because they may have had a vaccine that is not as effective as the one that is currently being used and has been used for decades. Is the vaccine that's responsible for us having eliminated measles transmission in this country over 20 years ago. And so the shorter answer to your question is that those people who were vaccinated decades ago with the vaccine that we're using today are expected to have lifelong immunity. And if they have documentation of that and we're in that restaurant or in other settings, there's no need for those individuals to get another booster dose because this is one of the most highly effective vaccines in protecting against measles for life.
Thank you for that, Baker. If you can, I want to go to a question that's in the chat from Meredith Montgomery with ABC. She asked if it's possible for us to speak to how many of the new cases are in children 18 years or younger.
The majority of the cases, well, let me make sure that we get the accurate data to you. We do have an age breakdown for those under the age of 5, those between the ages of 5 and 18 and adults above, and those above 19 and above. And to make sure that we get those numbers right for you, we can make that information by those broad age groups broken down for you after this call.
Yep. Happy to do that.
And I apologize, I just don't have all these numbers right in front of me, these specific details that I know you're interested in. But when we get to the number of cases that we have at this time, I don't have the end dates of the quarantine, the breakdown of cases, or that data immediately in front of me, but we're happy to get that for you.
Yeah, we'll absolutely do that. And I'll add that you can send some follow-up questions if you have any to media@dph.sc.gov. That's our regular agency media inbox too, if you have some follow-ups or you want to be included on those. Does anybody else have any questions for Dr. Bell? All right. With that being said, I don't see any. Thank you so much, Dr. Bell, for your time. I want to thank everybody else for attending the meeting. A recording of this meeting will be available on our agency's YouTube page at the conclusion of the meeting. And again, if you have any other questions, you can follow up through our media inbox, and I will give you back the rest of your afternoon and hope everybody stays safe and well. Thank you so much.
Thank you so much, everyone.